Welcome to our ACO compliance training. Your organization is part of Richmond Good Help ACO, a new accountable care organization created by Bon Secours Richmond Health System. As an ACO, we participate in the Medicare Shared Savings Program to provide coordinated care for Medicare fee-for-service beneficiaries. By meeting the requirements of the Centers for Medicare and Medicaid Services, or CMS, ACOs have the opportunity to share in savings that result from providing coordinated, high-quality care. As part of the Shared Savings Program, we must meet certain ethical and legal requirements and take part in compliance training. Knowing how to stay compliant is important because non-compliance can have serious consequences. These include termination of our contract with CMS, loss of funding, or civil or criminal penalties for serious or intentional violations. This training will cover 7 important requirements of our work as an ACO and explain how to get answers to compliance questions and concerns. You will learn about what type of care we must provide, whom we provide care to, how we must care for Medicare beneficiaries, how we communicate with Medicare beneficiaries, restrictions on the provision of free or reduced cost services to beneficiaries, confidentiality of patient information, and protections against fraud and abuse. Let's get started. As we work through the ACO to lower the overall cost of health care, we must continue to provide necessary and appropriate care to our patients. We must not deny, reduce, or limit medically necessary services to patients in the ACO, or overutilize services for non-ACO patients to offset reduced ACO revenues. As ACO providers, we are obligated to see all beneficiaries. Even though high-risk beneficiaries may have higher medical costs, they must receive the same access to care as other patients. We do not avoid treating those who are considered high risk by CMS, have 1 or more chronic conditions, are eligible for both Medicare and Medicaid, are diagnosed with a mental health or substance abuse disorder, have a recent diagnosis that is expected to increase healthcare costs, or receive healthcare services frequently. Our ACO is not a managed care plan or closed network. This means Medicare beneficiaries can receive care outside of our ACO, and we may not prevent them from seeing other providers. Our communications to Medicare beneficiaries must be approved by CMS. Advance approval is required for many types of communication, including Medicare beneficiary notices, brochures, websites, advertisements, mailings, social media, and other forms of communication. There is a specific process to obtain CMS approval of communications. Speak with your ACO compliance officer to learn more. We must also follow the rules for free or reduced rate items or services to Medicare beneficiaries. CMS rules limit how we provide free or discounted items or services to Medicare beneficiaries. Any offers must be reviewed by your ACO compliance officer and approved by the ACO's board. No matter what your role may be, protecting patient confidentiality and privacy is imperative. This applies to protected health information in all forms, including written, electronic, and verbal communication. Each of us is required to maintain confidentiality of PHI in all forms, access and use only the minimum amount of PHI necessary for your role, take reasonable measures to protect the confidentiality and security of PHI, comply with CMS's data use agreements if applicable. We are committed to following federal and state laws concerning fraud and abuse. By law, referral decisions must be based solely on patients' needs. We must not pay or give anything of value to induce or reward referrals of beneficiaries, offer, solicit, pay, or receive anything of value for referring patients or arranging for goods or services, or make referral decisions for any reason other than the healthcare needs of our patients. We need your help to make sure our entire organization stays compliant. It is your responsibility to report any compliance violations, such as actual or suspected fraud, waste or abuse, violations of law or regulations, or ACO policy violations. You can report violations to your manager, supervisor, or ACO compliance officer, or call our compliance hotline. Be assured that we prohibit retaliation in any form against individuals who report issues and concerns in good faith. Do you have any questions about ACO compliance? Reach out to your ACO compliance officer or access our compliance manual online. Thank you for your time, and thank you for supporting our participation in the Medicare Shared Savings Program.